Hello, and welcome to the Postpartum Years podcast. I'm your host, Dr. Mary Ellen Kramp, but today I am not going to be your host. The actual host today is going to be Elena Kramp. Elena is my daughter, and she is going to interview me today. So, welcome, Elena. Take it away.
Alrighty. Well, I'm Elena, and along with being, Mary Ellen's youngest daughter, I am an occupational therapist. I largely work in behavioral health, so you might see some of that come through in my questions as I ask her about, you know, um, my birth, like the birth of me, and her postpartum experience, and really what that was like for her. I guess to just kind of get into it, I wanted to ask you, and you'll see me look down at my notes. What was the original plan or expectation for my birth?
Well, the original plan, let's see. Well, you were huge. Um,
I do.
So, and David had been huge too. So my second child had been a rather large baby for the pregnancy for both my second and my third. I was being sent for an ultrasound early on in the pregnancy to count how many babies were present. Because at 9 weeks in particular, my uterus was measuring 19. Like my uterus wanted to have a palace available for fetuses, and yeah, it was very interesting. You grew very quickly, and by 36 weeks, I think you were well over 7 pounds. When I was pregnant with David, that OB that I had at the time had said, I really like my babies within this, weight range. And, if they're over 10 pounds, it's a C-section, no ifs, ands, or buts. And I'm like, I'm not going to consent for that because I already know I have a pelvis that can handle large babies. So when it came to you, I didn't have that same OB. I had his former partner, and I told him the checkup where he was saying how large you were, like, just so you know, I will not consent to a C section based on weight because I know I have a very large pelvis and I can easily handle a very large baby. And he said, okay, so we'll compromise. We'll do an induction at 39 weeks. So that's what we did. I went in, they started the induction. And I think that was, if I remember, yeah, that was around midnight, probably a little after midnight, that they started the induction. Yeah, the contraction started, blah, 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 blah. Not too harshly initially. It wasn't until, for each of my three pregnancies, it wasn't until after my water broke that my contractions really got severe. And since I had seen this the first two times around, um, I had it in with the day nurse. We had this plan, like as soon as my water breaks, she's calling anesthesia. I'm getting an epidural. So my water broke. It happened at 7 p.m., which is change of shift. And so
Yeah.
my day nurse was discussing with the night nurse, going through, okay, this is, these are all the patients, this is what's happening. But this woman came in about 20 minutes later and introduced herself as a nurse and said, hey, I'm your nurse and blah, blah, blah. I'm like, great. Because I was in the middle of the contraction when she came in, like, my water broke, please call anesthesia. I want the epidural now. And she just turned and walked out of the room. Nothing happened because she wasn't a nurse. She was a patient tech. And she didn't share with the nurses that my water had broken and I was asking for anesthesia. So the night nurse, they finally come in as, the day nurse came in to say goodbye. The night nurse came with her, and I'm like, where's anesthesia? And she goes, what are you talking about? I'm like, my water broke at 7. Where's anesthesia? Whoever was in here before, I told her, and like, where's anesthesia? And so they went and called anesthesia. And of course, they had just gone in with somebody else. So now it was like 8:30 before I had an epidural. And in the meantime, the night nurse, she's only seeing me like in this state where my contractions are literally a minute apart. And so it's one on top of another. I have actually hooked up to monitors because I was induced. So they keep a monitor on my uterus, keep a monitor on the fetal heart rate. And the night nurse is like upset because she can't really see the monitor really well because I'm moving constantly because, like with my first pregnancy, which was a natural birth, I walked through every contraction. I could manage my pain just fine walking through every contraction. So I was at the end of the bed and I'm rocking and I'm moving. And the nurse is like, you need to be laying down. I'm like, I will as soon as anesthesia gets here. So it took until 8:30 to for anesthesia to arrive. So I had been stressed, really stressed for like an hour and a half. And the night nurse, like, we did not have a rapport at all because she just saw me as like this bitch that did not want to follow instructions. And I'm like, I need to manage my pain somehow. And I can't do it laying still in a bed. I need to be moving. So that was about 8:30. Finally get the epidural. So I'm probably getting tucked into bed probably close to 9. I see the nurse once I'm kind of in with the epidural, tucked into bed, and she is looking at the monitor and she just walks out of the room. Didn't say a word. Then she comes back a little bit later with the OB. So this is probably now about 9:15, 9:20, and he's spending some good time looking at the monitor and he's going, yeah, the monitor's behind my head, so I can't see what's going on. Your dad is sitting to my right in a chair, and he's looking at the face of the OB, and then he's looking up at the monitor, and he's watching, the heart rate and the contractions, and oh yeah, and also the other thing that had happened with that was the night nurse, right before she left, she's like, oh, you're due for your next dose of medication for the induction. And your contractions are going well, but I don't want it to drop off. I don't want your contractions to stop at this point. So I'm going to give it. But I'm also the type of person who, for some medications, you just kind of like show me the bottle and like I'm near it. So like my body's like, okay, I've had it. And apparently that's one of the types of medications because she gave me that medication, or it must have been the night nurse because it was afterwards. It set my uterus into tetany. So they had it. So it was like one long continuous contraction that happened right after I had the epidural. Okay. And after that, they had to give me a medication to slow it down. So my uterus could like contract and relax and contract and relax.
So when you say tetany, it's like tetany this is like contraction,
like this sustained. It is just this long sustained contraction. So that's probably one of the reasons why she had to go get the OB. So they gave me that medication. So that was, probably around that 9 o'clock time where I got that medication, a little after. So the OB is in the room. He's watching the contractions. He's watching the heart rate. So when your father noticed his look, he starts watching the monitor as well. And he's got a magazine in his lap and like, it's been 20 hours, it's been
okay. So you were in 20, labor for a while.
Yeah.
For a while.
Yeah. The OB is not saying anything. He's just like kind of inside his head trying to figure things out. And your father looks and he goes, now remind me, late phase deceleration of the heart rate, that's indicative of blah, 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 or blah, blah, blah. And
Dad's running his own differential.
Yeah. He had just finished his residency. And so he, and this OB, because we had only moved like 7 weeks earlier, he didn't know us very well. And I don't know that he had even met your father because he'd be taking care of your brother and sister while I went to appointments. So I had told him, my husband's a physician. He didn't really know. So it was really funny when the OB heard that question, especially the way it was phrased, late phase deceleration, is that indicative of, and here's the differential. And he goes to your dad and goes, what are you reading and lifts up the magazine, and it's four-wheel drive and off-road magazine.
That tracks.
Yeah,
That tracks.
yeah.
Dad.
Like, yeah, he's an ER doc. So that's why he's asking those things. And so they, it just start in because I had figured out this OB. He was a high risk OB, and I ended up with him only because there had been like a major insurance shift, and like this huge amount of OBs left that area, and so there was like no way for me to get in. And so the only way I got in is I had gone to my previous OB and said, "Hey, just moved back into town. Um, can I get back into your practice?" He's like, "I don't deliver anymore, but here, let me walk you over to his practice and, get you in that way." So that's how I ended up with this doc, because I had like an absolutely boring pregnancy. The only thing they found, and it was he that found it, uh, he found that you only had one umbilical artery. There's usually two umbilical arteries, but you only
Oh,
had one. And, it's not that big a deal typically, but
yeah.
apparently, particularly if there's compression on that artery, that becomes a much bigger deal. But anyway, so he's watching that on the monitor, and he was really, really focused and taking some time. But this doc was an OB who was bored to tears with like a run of the mill pregnancy, and he was very like on if something was happening. I saw it with somebody like another patient in the hospital. I'm like, I've never seen him like that, like really focused and really into a patient when I've been in the office. But that patient had something going on, and he was like, boom, right there. And like all of a sudden, he met me for the first time when your heart rate was dropping. He was like, it was a different person suddenly in the room. It was a little after 9:30, because I remember seeing 9:40 on the clock in my room before I left. He said, "We need to do a C-section, and we need to get this baby out." And I'm like, "Okay, I guess I'm having a C-section now." And the
Was
thing
there
is,
any explanation at that point? As like, did you know before he
he
said, "We're doing this"?
he thought the placenta was abrupting.
Okay.
So he goes, "I think the placenta is abrupting." I'm like, "Okay, it's a C-section then." That if the placenta is coming off the wall of the uterus,
Mhm.
it's putting me at risk for hemorrhage. It's putting you at risk, for death and stuff.
Yeah.
So, but yeah, like absolute necessary reason for a C-section right then and there. We're like getting ready to go in, and your father, I had to laugh because he goes, "Honey, are you okay that you're going to be having a C-section? Are you okay with this? Because I know you didn't want to." I'm like, "It's a placental abruption. Yes, this is a reason for a C-section. This is absolutely like that. I don't need to think twice on that. You know, her life's at risk. My life's at risk. Yes, she needs to come out right now."
Sweet of
Um,
him to check in.
huh?
Sweet of him to check in, but
Yeah, yeah, I
fair
know. I'm like,
answer.
yeah, like, yes, of course I understand. Like, if he's going to tell me, "Oh, we should do a C-section because this baby's big," I'm like, no, just let me try to push. I've had two other babies. I had one where his head circumference was not on the chart. Like, yes. And after his head was delivered, the OB said, "Oh my God, what are the shoulders going to look like?" I'm like, "Dude, I can hear you." We're this close. I can hear you say that. Why did you say that out loud? But yeah, I know I can deliver a large baby. So to have somebody say, "Oh, it's a big baby, let's just do a C-section." No, I'm not okay with that. But I think the placenta is tearing off the wall of the uterus prematurely. Yes, please, please cut me open and take this baby out right now. I had a couple of nurses in the room. All of a sudden, there's like a second IV bag hung. They're like squeezing the bag to push as much fluid into my body as possible. It was like fast and furious. And this is a hospital that I had worked in. And I had always heard the calls overhead, so you hear like code blue, and they would announce what department, it's like code blue 2 north or code blue, 4 south or code blue. And it's like I knew like what was on what floor. And when I'd hear like anesthesia stat to 3 south, I knew that was, a mom in trouble. And that always just kind of like made me cringe a little bit. So I was hearing overhead, anesthesia stat 3 south, anesthesia stat 3 south, anesthesia stat 3 south. Like, fuck, that's for me. So that sucked. I'm a caregiver, I'm not the patient. I was only a patient because I was having a baby, but I was supposed to go in, quickly have that baby, and get me back to mother and baby, and I'm done. And I can complain about having to walk out of the hospital. You're making me stay in the hospital for 48 hours and I'm bored. But having those calls specifically for me, like, that really sucked. So saw 9:40 on the clock in the room. We get into the OR. Anesthesiologist, the person who should be like the calmest person in the room, was freaking out. And part of his freak out was that the OB allowed your dad to be in the OR.
Oh, okay.
Normally, for those situations, a scheduled C-section, yeah, dads are typically in the OR, but when it's a situation where they don't have time to convert your epidural to a spinal for the C-section, they have to put you under general anesthesia. They typically don't allow dads in the room for that level of C-section. And because he had been and assisted in so many surgeries for his residency, the OB was like, yes, of course you can be in. So he allowed him to be in the room. And I'm really glad he was, because he was able to explain a lot of things to me later that were not explained to me at all. So anesthesia panicked that he was in the room. And, it wasn't until the OB walked back in the room when your dad's trying to say, he said it was fine for me to be in for the C-section. And the anesthesiologist was just panicking. And in his panic, he forgot to turn the oxygen on. So a little while later, when I was under, he couldn't figure out why my oxygen saturation kept dropping, no matter what he did, until he realized the oxygen wasn't on. So there's issue number one. So they do the C-section, and you're delivered, you're fine. That was at 9:52. So I saw 9:40 on the clock in my room. You're delivered at 9:52. So it was basically the amount of time it took the surgeon to scrub in and for everybody to get into the OR is how long it took from when he said, we need to do the C-section to when you were born. And at that point, because they had given me medication to slow down the contractions, I guess it kind of hit the peak right about the time that you were delivered. So my uterus wouldn't contract afterwards, because normally they deliver the baby, they deliver the placenta. And when the placenta comes off the wall of the uterus, there's it was like blood vessels, all kind of tied in there. So there's a lot of bleeding. And the bleeding wouldn't stop, because usually the uterus contracts down and it kind of makes stops that hemorrhaging from happening. So I was hemorrhaging on the table.
So have there also been like a placental abruption like the doctor had thought, or was
No,
it?
the placenta had not abrupted. So
Okay, and
what
that's what led
actually,
to the hemorrhage.
no.
No? Okay.
So, so what had happened was, I was very, very, very close to starting to need to push when I was like probably 9 centimeters dilated, maybe even 10 at this point. So you were engaged, but the thing is, your umbilical cord was under your head. And so it's called an umbilical prolapse. And that's also another reason for a crash C-section like that.
Yeah.
So the umbilical cord had prolapsed. He didn't know it at the time. Um, he was just, there's like a list of things that can cause the decrease in heart rate that you were having. So he thought it was a placental abruption. It wasn't. It was the cord prolapse. But because my uterus could not contract when they delivered the placenta, I was just hemorrhaging. And the way your father described it to me was there was a liter of blood in the canister and more on the floor. So I lost well over a liter of blood in the OR. Um, he said, in order to get my uterus to contract down, okay, this is going to sound gross to a lot of people out there, but this is what that he had to do. He removed my uterus from my body, put it on top of my abdomen. He was rubbing his knuckles across my uterus to try to get it to contract. Your father said, I did not think you'd leave the OR with your uterus. But he was trying to stimulate it to the point that it would start contracting. And it did.
Huh.
So I was able to leave that OR with my uterus. And then he sewed it up, put it back in, and had two different residents. There were two different residents. I didn't even know that there were residents until afterwards. And that's going to be another story. So I whew, um, lost all that blood. And as a very short period of time went on, as he was managing that, my blood pressure is going down and it's going down to the point where it's 50 over nothing. And your father is like watching my blood pressure and shooting looks to the surgeon and the anesthesiologist, like, guys are going to do something or I will. So they just like put more fluid into me, and wish they had put some blood because that actually carries oxygen. I, first didn't get oxygen, then I hemorrhaged a bunch of blood, then I lost my blood pressure for several minutes, and then still kept a heart rate somehow, and then did okay for a while. I guess the OB sewed up the uterus, and then the resident sewed up everything else, and they brought me to recovery. And when I was very first opening my eyes in recovery, the nurse said, "Oh, are you having any pain?" And I'm like, "Where am I? What just happened?" Okay. Okay. Yeah, it was a C-section. And I said a little. She did not ask if I wanted pain meds. She didn't ask your father. She just shot Dilaudid or Demerol into my IV, and I had barely just come out of the anesthesia. I promptly stopped breathing, and I learned what it was like to overdose on medication. Um, and I felt like I suddenly became about this big inside my own body, and I was way down, like deep in my chest, and I was really tired, and I just wanted to go to sleep. And I knew I needed to breathe, but oh my God, I'd have to like go all the way up here to take a breath. I'm like, oh my God, no. I was just got to go to sleep. Your father standing right next to me, being the ER doc he is, he starts doing sternal rubs because he's watching my oxygen saturation plummet. And he's like, breathe, breathe. So he stood there because the nurse freaking took off. So he stood there doing sternal rubs and keeping me breathing until enough of that wore out that I could, just breathe on my own regularly again. So yeah, that was fun. So like 3 times in a very short period of time, they tried to kill me at that hospital.
Because I knew about, like, the hemorrhaging, and I knew at one point you were administered medication that you probably shouldn't have been administered, but I didn't realize you had effectively overdosed or just
Yeah.
straight up overdosed and might have passed had dad not been there.
Yeah. Well, hopefully enough of the alarms would have been ringing in that
Yeah.
they would have noticed that I stopped breathing.
Yeah.
At that point, once I finally started coming around, it was so funny because I'm like just trying to open my eyes and like regain consciousness. And your father comes over with you and goes, "Do you want to breastfeed?" And I'm like, the only word I could muster was no. Like, I can't hold a baby, and I think my milk would kill her. Like I could barely
Very
handle it. Give her a bottle. Like I'll feed her later. I mean, there are so many things that like I know I processed, but there was like no ability for me to like get it out of my mouth. But I'm like, no, 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 like that is not a safe plan for either of us. Like, I cannot maintain consciousness. I cannot hold a baby. I'm not sure my milk would be safe for a baby right now. Like, let's not do this. He gave you a bottle, and you were rather hungry, and she handed you a bottle. The nurse handed him a bottle with maybe like 2 ounces in it, and you were just like going to town. And after a few minutes, your father said, "Oh, how much should I give her right now?" And she goes, "Like probably about a half an ounce." And he goes, "Well, she took an ounce and a half, so I'll hand this back to you." But yeah, the next morning when I woke up, I felt like I had been run over by a truck. I had had two babies at this point before, so I know, yeah, postpartum you're not terribly comfortable, but this was this was different, and I'd had surgeries before, and like this is really a little different than like post-op pain. I mean, this is like I shouldn't feel like I had been run over. Like what happened? Because the OB didn't mention, oh yeah, you hemorrhaged on the table, or yeah, we had to put your uterus on top of your body and like really get it to contract down. Because I think that's what a lot of it was. I mean, because the uterus is still huge at that point, and
Yeah.
it had been beaten essentially, like smack it up with a hammer or baseball bat and then stuff it back in my body is kind of what it felt like. And like, okay, well, that makes more sense now. Then I ended up with a massive infection. I was on 3 different IV antibiotics at that point to try to get the infection under control. I felt so miserable. The very first time I stood up later that morning to go pee, um, they, oh my God, it was awful. It felt like my abdomen fell apart at that point in time. And just then, those two residents were coming into the room and they were introducing themselves as the residents who had, been in the OR during my, C-section. And I said, I just stood up and I feel like everything just fell out. Like, like my abdomen just collapsed. Like what? I don't understand this. And they just looked at each other, turned around, left the room. And then when I talked to your father a little later, he said, yeah, they are the ones that sewed you up after the C-section, but they never told the OB. They, it was, it was August, and the OB rotations would be like in the clinic, in the hospital, in the clinic for a month, in the hospital for a month, in the clinic for a
Mhm.
month, in the hospital. So this was their very first rotation in the hospital ever. So I'm like, oh, great. Were they supervised appropriately? I'm thinking not. So there was that and the massive infection, which took like, I think I was in the hospital 5 days on antibiotics. And at one point, um, just getting the antibiotics, consistently through the same vein veins can just like, and I'm done. Especially if somebody comes through and just tries to push fluid through very quickly. That's an easy way to blow a vein. So I had one blow and they had to move the IV site. Well, because they had given me so much fluid, right before the C-section, during the C-section, I like, you couldn't, I was just so bloated everywhere. You couldn't see veins. And I was trying to point them to, okay, I know I have a really good vein here. I know I have a really good vein here. And she was like insisting on going on, this particular one on the back of my hand. I'm like, anytime somebody's tried to do an IV, I think there's a valve there that it's not going to work and it'll blow the vein. They tried 7 different times to get an IV. And again, being married to an ER doc, I know where they go when they can't get one of the peripheral IVs. They want to go into your neck. And I'm like, I don't want this massive, IV line in my neck. And, I'm a little emotional at this point. So I'm crying. And luckily, the OP was like just coming in and doing rounds. But I could hear the nurses out at the nurses station, like, ew, she's just so, we shouldn't even have her on this floor because, she's too complicated. And then she's just so emotional. And like, I
Did there
can
nurses
hear
on
you. Oh, like,
a delivery floor saying somebody is so emotional as like,
I
okay.
know. I know. I know. Yeah, I've just been stabbed 7 different times.
Cut
They've
open with
already
uterus.
blown, another vein that I told them, please don't use. I mean, it was crazy. It was just crazy. And so, the OB comes in and he uses the vein I told him to use and got it on the first try. And I was kind of scared because, you know, physicians don't typically do IVs. You know,
Yeah.
that's not their thing. That's usually nurses, and often they have IV teams that will come and do hard sticks. And the IV team couldn't get it on me either. So I was like, okay, this physician's going to try once, and if he doesn't get it, I know I'm going to have a surgeon coming in, or an ER doc or somebody to do a central line, and I didn't want that. But he listened. He put it in the vein I said is a really good, easy vein to get. And there, we were done. So it was like one thing after another, after another, after another at that hospital. Oh, and then there was the time where I was feeling really miserable. You were like really, you just wanted to feed constantly. And it was like all night long. And I called the nurse's station and asked, could you please take her to the nursery um, so I can sleep? And the nurse reprimands me, not coming into the room, via intercom. Ma'am, you're going to have to learn how to deal with this.
Oh my God.
I'm like, yeah, I know. I know, but I'm trying to heal from a C-section. I have a massive infection. I'm taking Tylenol and Motrin round the clock to keep my fever below 102. Could you please help me with this baby and do your fucking job?
To say that over the intercom and not,
Not even bother to
come
like
you or
say
have
it
an
to my face.
conversation.
Yeah. So on one hand, they're trying to get me off the floor. They were petitioning to get me off the floor because I was more complicated than a typical postpartum patient. I needed more medical attention. But at the same time, then they're telling me to suck it up and deal with my baby. You're too complex to be on this floor, but we're not going to give you any help with your baby. What the hell?
That's ridiculous.
So finally got discharged 5 days later. Um, but yeah, that was not a pleasant experience.
Does not sound like it. It never sounded like it.
There was the occasional nurse who was great, like that day nurse, labor and delivery. Oh my God, she was wonderful. She was absolutely wonderful. And then I had, the occasional nurse. on the postpartum stay who was really good, but there were a couple of them, and I just want to say, like, if you're gonna cop a major attitude to somebody who is sleep deprived, who has a massive infection, who's just, trying to recover from the birth of their child, whether it be just a vaginal birth, because yeah, I mean, the amount of pelvic floor injury that I see, or a C-section where it's a major abdominal surgery. That's a lot for one person to handle. Because I can tell you, a natural birth um, without any issues is rough to recover from. So add all those other things on top of it, and you need help. You really do.
I mean, at what point were you able to like hold me for the first time?
I was able to the next morning. The
The
next
next
morning.
morning.
Yeah. So you were born at 9:52 p.m. So next morning, I was awake enough, alert enough to be able to breastfeed, to be able to hold you and do everything I needed to with you. But those first few hours, I just could not. I wasn't conscious. I literally wasn't
Yeah.
conscious. Between the general anesthesia, which takes me a while to recover from in the first place, and then the overdose
Yeah.
that took me a little bit longer. So we're going to stop right here at the end of the birth story. And I hope you enjoyed this. I hope your births are much better than this one was. And on the next episode, we are going to go through more of the postpartum period. So thanks for joining us. We'll see you next time.
Thank you.